Hello, my name is Christo Albor, and I'm here today because I co-wrote a chapter for this book with Guppi Bola, and our chapter was called Beyond Saving the NHS, The Future of Our Health.
Okay, and what's the gist of the content?
So we basically split the topic of health as it relates to this book into two. One half was about inequalities, socioeconomic inequalities, and how that leads to poor health. And the other half was about the marketization of the NHS and how that's bad for our health. And Guppi wrote that second bit, and I did the first half. So do you want me to talk about that a little bit? Okay. So I did some research related to health inequalities, and this got me to reading a lot about socioeconomic inequalities in Britain, and which is why basically I got asked to write this chapter and try and relate it to our generation. But actually what I wrote is relevant to all generations. It's just about how when you have a lot of inequality, income inequalities in a country, it tends to lead to poor health through various mechanisms. And so I was proposing that in our generation we could try and fight for slightly more equal incomes, not exact equality, but less inequality that we currently have. And the various things I talk about aren't just to do with everyone should go up through social mobility, but that we should learn to respect people across all socioeconomic classes, all different types of occupations. Some of the mechanisms in which we get ill can be psychological, that lead to psychiatric illness, as well as physiological illnesses, physical illnesses. And that could be through a behavioral thing, through eating too much, or through your lifestyle, some kind of lifestyle thing, or it could also be a direct thing to do with your cardiovascular health.
It could be that the older generation have had all the benefits of a national health service, which now are going to be whittled away for future generations such as yours and ones to come.
Could well be, but then if we think about the other things apart from the NHS, the living conditions they had are really a lot worse than what we've had. I mean, we've had it pretty good growing up. I mean, I grew up in the Philippines, so it's a bit different, but, generally.
How much do you know about the work of the Intergenerational Foundation then?
Very little, actually, because I got to write this through Guppi, who is really more connected to everyone else on this book. And so I went to a couple of meetings in planning the book, but I didn't know who was funding it or who it was attached to or anything like that. I know one of the editors, Guy, and that's about it. Are you going to tell me about?
No, I was just, if you knew anything about it. And, I mean, would you say that there are any sort of intergenerational factors impact particularly on you? I mean, are you aware of any, or does it have an effect on your student loans, for instance, or, thinking about pensions for the future?
Well, it's hard to get on the property ladder. I don't even really think about it. I'm on my third degree at the moment, and so I have a lot of loans, and so my first degree I finished in 2006. I paid £1,000 a year roughly for my tuition. My second one was a PhD, so that was through grants anyway. But then now on my third degree I'm paying £3,000 roughly a year. But I know that if I'd started that next year, then I'd be paying £9,000. So there are some obvious intergenerational issues there. But also I remember going past a poster a couple of years ago about property prices, and it had a chicken on it. It had a frozen chicken, I think, and it had the price of this chicken as being in the hundreds. And I was thinking, who would buy a chicken like that? And it said, well, it had some kind of generation, or so if you were born at this time, this is how much a chicken would cost if it was equivalent to how much houses cost now. And so that really brought it home that they had it good, like my parents, their parents have had it good. And people talk about, we bought a house for $5,000, $10,000. And you think, well, that's because of the prices back then. But it's not just that. It's because they were, on relative terms, much, much cheaper. So that's how it affects me anyway. So you just don't really think of buying. I mean, unless you have got someone who's like sort of saved up some money for you, through working, you just don't save any money now.